And what advice would you give to choosing a medical school or applying or anything like that?
Well, okay, so I think I don't know if it necessarily matters what medical school you go to. Just you take the MCAT, take your prerequisite courses, and see where you get in. And if you have different options, to pick one that you feel that you're comfortable in. Because I had three options.
What were those?
UT San Antonio, UTMB in Galveston, where I went, and Houston.
UT in Houston?
Yeah, UT Health in Houston. And I just really loved the atmosphere in Galveston, the collegiality. It's really nice group of people, and all those people are still my friends. So if you have choices, really go to the place that you feel comfortable and like you fit in, and that there's not a as much competition, but it's more collaborative experience.
So besides academics, what are some things that you can do better in as far as getting into medical school? Like, did you do any clubs or stuff like that? Anything like that?
Well, back then they didn't have as many things, but I did do research. So I did lab work 2 summers between sophomore year and junior year in San Antonio. So that was helpful. But now you can do all kinds of things like internships. So you can work in doctor's offices, you can shadow physicians, you can still do research if there's opportunities. But I think the most important thing is to work in the field, volunteer or shadowing or office work, so you can kind of see what it's like.
Okay, and what were you researching when you were doing before medical school?
Okay, so one summer I worked in a nephrology research lab, which is kidney research. And so they were injecting rat kidneys with certain things and looking under the microscope at what happened at the cellular level. And so I originally started out having to cut the rats open and take the kidneys out, but I could not handle that.
Really?
Yeah, I did not do well at all. So I asked to be moved out of that. And then I was just taking the cells, and in order to look at them under a microscope, you had to prepare them in different ways. So that's what I would do is prepare the cells so that then the people that are more trained than me, such as college student, could look at the cells under a microscope. So that was the first year. And then the second year, I did work in the same nephrology kidney research unit, but it was in clinical care, so it was really fun. We were doing research studies on people in the hospital. So we were just testing with their kidney function of people in the hospital, and so I would help set up the study and organize it. And then I also did some of the actual basic science research, so I was preparing the samples so that they could run them through various machines and look at what they needed to look at.
Okay, and what do you think the greatest challenges in completing medical school and becoming a psychiatrist are, and how would someone like me get over that, or anyone who wants to go that far?
I think the hardest part is getting into medical school. It's just doing all the coursework and studying for the MCAT and all that.
Is it just the MCAT? Is there an application, or once you pass the MCAT, are you in?
Well, there's no passing the MCAT. You just have to try to get a good grade. It's kind of like the ACT or SAT. You just try to get a good grade.
Oh, so it's not you pass, you're in?
No.
Oh,
that's just part of it. It's like school, like applying to college, where it's your application. So your grades in college, but also other things you've done, like research or shadowing or working in a doctor's office. And then your scores on the MCAT. And also it helps if you have done other things besides just biology, like maybe you have biology and then you have a minor in something else. So they really kind of look at the whole picture. It's not, they look at numbers first. It's just like college. They look at the numbers and then you have to have these other things. But once you get in, I think then it's better because people are still competing for those top spots, like who graduates first through 10 or whatever to get whatever residency they want. But most people are not. You're just kind of working together. You're kind of in the war zone of medical school together and making friends and learning new stuff. So to me, it's hard work, but it's not the same kind of stress as, oh, am I going to get in?
Yeah.
And then when you're in medical school, you rotate through all the fields, and so then you can decide what you want to do. Like I didn't think I wanted to be a psychiatrist, but I was thinking I wanted to do internal medicine. But then once I did psychiatry, I realized, oh, I'm really interested in that. It seems like I'm good at it. You get a feel of what you're good at and not good at. So yeah.
So when you're in medical school, I was going to ask, like, how do you figure out what you want to do? Do you do everything? Like, did Dad like?
Yeah. So first and second year, you do classes. So you do, anatomy and biochemistry and all this stuff. And then third year is all you do is rotate through each of the specialties. So internal medicine, surgery, and in those you do like maybe cardiology under internal medicine, or nephrology, which is the kidney one, or it's surgeries. You could do ortho, or you do heart surgery, or you kind of can pick which one you want to do in there.
Mm-hmm.
And then you do psychiatry, and you do family medicine, you do pediatrics, and you do OB-GYN. So you have to do everything. Okay. And then senior year, you can take more like electives of things that you think that you want to do. And you can go around the country. Like if you think, okay, I think I want to do psychiatry, but I think I want to go to Colorado. So I do a month in Colorado. Like my friend and I, we did actually a month in Spain of psychiatry.
Oh, well.
It was really
I was going to ask if you went during medical school to Spain.
Yeah. And we worked with a psychiatrist, and we had a great time. Mm. Yeah. So you get to really, the senior year, you get to explore what you want to do. And then you can also kind of travel and have some fun while you're doing it. So you really can go all over the country and try different rotations, or you're also looking at the program. Mm-hmm. So obviously I wasn't going to go to Spain except for fun. But you can go to whatever, say you want to go to Colorado, or you want to go to Washington, you go do a month there of whatever field you're kind of interested in. Or maybe you think, okay, I want to do internal medicine, so I'm going to go to Seattle and do it. And then you realize, I don't really like internal medicine. So then you can go do something else in another city. Mm-hmm. And all that while you're applying to what residency you want.
Okay. And once you get out of residency, what did you do? Because I know you kind of built your own thing. Mm-hmm. How does that work?
Well, so when I did residency, 3 years of residency, and then I did a fellowship in child mental psychiatry in Denver. And that fellowship was really great because it helped me to be able to do all kinds of things. Like my last year of fellowship there, I had to manage my own schedule, seeing my own patients, which is kind of like private practice. Mm-hmm. I flew to Montrose, which is right by Telluride, once a month to work 2 days a week. And so I was basically the only psychiatrist in that area. Mm-hmm. I also worked in a day treatment center, therapeutic preschool, and so I did all these different things. Oh, okay. So when I got out, but that was just there, so I got a really good experience. When I got out, I was comfortable managing all these things. So what I did is I got an office with my friend and paid rent and all that. But since it's really hard to build up a practice of new patients, mm-hmm. That was only a small piece of my work. And then I worked at a residential treatment center, like, have adolescents that are living there because they're struggling with psychiatric issues and they're going to school there. So I worked there, and I also worked at another outpatient clinic. It was called Denver Children's Home. So that was like middle school kids that were kind of living there. And so I'd go see them a couple times a week. And then I also worked at this therapeutic preschool and another treatment center. So I did all kinds and a managed care place. Mm-hmm. So I basically, every morning I was going to a different place around the city, and then I'd do my private practice in the afternoon.
Okay. And then you built that up basically to just focus on that.
Well, I stayed doing kind of half-time the other stuff there because I really liked it. And I would mm-hmm. do that here, but there's not a lot of that here because I really like doing all the different kinds of work. But then we moved, and so I moved here, and I actually worked at the mental health center, the city and county mental health center. It's called Integral Care now. So then I worked there, and then I slowly built up my private practice. But if you're building up a private practice and you need income, you need to have some other side jobs so that you're not feeling like, oh my gosh, what if I don't have any patients? Mm-hmm. So that's what I did in Denver. Here, I didn't have to do that because Dad was working. So I'm just like, okay, well, I'll just let it build up when it needs to build up.
Okay. Well, I think that's all my questions. So, yeah.
Okay.
That was good.
Thanks.
Dinner is ready.